My name's Chris Sale. I'm the co-founder at Nonicus, and Nonicus actually means no needles in Latin, as we focus on developing non-invasive diagnostics. Today, I'm going to talk about our leading product, Galeas Bladder, which is a urine-based bladder cancer test, really opening the door to home-based urine testing for bladder cancer. When we talk about the problem and how we can benefit healthcare, at the moment, the leading cause or the leading symptom, let's say, of bladder cancer is blood in the urine or hematuria. People will show up at their GP worried about blood in the urine, and they'll be put forward for a 2-week wait. After which they'll have a cystoscopy. A cystoscopy is a really invasive test, effectively putting a scope up the urethra into the bladder to visually inspect the bladder for a sign of bladder cancer. This method is 200 years old, and as well as being invasive, only picks up 10% of the total number of patients as positive for bladder cancer, meaning 90% of patients don't need this test. With Galeas Bladder and a home-based urine test, we can remove up to 90% of patients from that cystoscopy requirement. So what is Galeas Bladder? So effectively, what we're doing is with a collection kit on the left-hand side, this can be posted out to people's homes, whereby a stabilizer within the urine collection device can collect the urine. It can be posted back into our lab within 30 days. What we then do with the sample is we effectively look for the presence of tumor DNA within the cell pellet and the cell-free DNA fraction. We're specifically looking for a signature of bladder cancer mutations that we have tested and validated within 23 genes and 450 specific mutations. Of course, work at a company developing a test like this cannot be done alone. This work was undertaken with the University of Birmingham with Cancer Research UK funding. We processed up to 4,000 samples, published 5 studies, and have 8 ongoing studies for further applications within the bladder cancer space. Of course, the gold standard method, this cystoscopy, is actually a rather good test. So any test that could replace that and benefit patients has to be as good as that. So here we show some data created from a real-world evidence study across these leading NHS trusts, with the thanks to the urologists, the nurses, and the patients for consenting to this study. We've been able to show that the sensitivity, specificity, and importantly, the negative predictive value of the test, given that it's a screen, are superior to the gold standard cystoscopy. What we also do at the end of our testing is we create a really simple report for the clinicians, which basically says bladder cancer positive, bladder cancer negative, and where it is positive, the specific mutations which are sensitive for the bladder cancer. Importantly, what this test offers to patients and the wider healthcare community is the ability to save lives. We're cutting down waiting lists with a simple test that can be delivered and collected as a sample from home. We're able to save lives by detecting cancer earlier. We're saving a huge amount of time, enabling the urologist to do other types of work rather than these basic cystoscopies. And we're also saving the NHS a huge amount of money. Thanks ever so much.